You take your blood pressure pill every morning to save your life. But what if that very same pill is quietly killing your sex life? Your cardiovascular numbers look stable, yet when it comes to the bedroom, things are responding slowly, softening too quickly, or just not working like they used to. And now you are facing a terrifying question. Do you keep taking the medicine to protect your heart, or do you risk stopping it just to save your erection? Hello, I'm Dr. Emily Carter, a urologist specializing in men's health. If you're watching this, you're likely over 45 and fighting this battle in silence. Embarrassed to tell your wife and hesitant to ask your cardiologist because you don't know how to bring it up. But listen to me. Sexual function does not decline for no reason, and you are definitely not alone. Real quick, before we fix this, if this sounds exactly like what you are going through, type a 1 in the comments right now. If not, type a 0. I read your feedback to ensure I'm creating the content you actually need. And please subscribe if you want to protect your vitality for the long haul. Now, here's the cold hard truth. High blood pressure itself is an enemy of erections, but paradoxically, the wrong medication can make the problem much worse. So, which pills are the culprits? What is a misunderstanding? And what should you actually do to stay safe without sacrificing your performance? I'm going to explain the solution clearly right now. Many men start noticing something strange soon after starting their medication. You feel calmer, your heart rate slows down, and that pounding anxiety fades away. That's great for your health, but in the bedroom, it's a different story. Your arousal response doesn't feel as fast or as sharp as it used to. And I want to tell you right now, this is not a coincidence, and it is certainly not just in your head. Here's the science simply put. An erection is a delicate hydraulic event. It requires perfect coordination between your brain, your heart, and your blood vessels. When desire kicks in, your heart rate needs to rise slightly to pump blood, and your nervous system needs to send a go signal. But here's the problem. Some blood pressure medications work by explicitly putting the brakes on your system. They cap your heart rate and dull the nervous system's ability to respond to excitement. My patients describe it perfectly. Dr. Carter, I still have the desire, I still love my wife, but my body just won't shift into gear. It's like having a sports car where the engine is fine, but the gas pedal is stuck against the floor. This mechanical disconnect causes men to spiral into anxiety or question their marriage, when in reality it is just simple physiology. But listen closely because this is crucial. If you only focus on a beautiful number on your blood pressure monitor while ignoring these warning signs, you are missing the full picture. The good news, not all medications act like a parking brake on your love life. Some are notorious erection killers, while others are actually erection-friendly. So which one are you taking? Let's look at the specific list right now. I always make one reality very clear to my patients. Taking blood pressure medication is not a guaranteed sentence to sexual dysfunction. However, there are 3 specific classes of drugs that carry a notoriously higher risk. And the problem is, you might be taking them right now without even realizing it. First, let's talk about the old-school medications. The central agonists like clonidine or methyldopa. These drugs act directly on your brain to force your body to relax. It sounds heart-friendly, but for your sex life, it puts your nervous system to sleep. Your brain fails to send the speed-up signal to your heart during arousal, making erections weak or impossible to maintain. Second are the diuretics, often called water pills, like hydrochlorothiazide or chlorthalidone. These alter your fluid balance, which can restrict blood flow to the penis. But even worse, they can flush out zinc, a critical mineral for testosterone production. So you're not just losing blood flow, you're losing hormonal drive. And third, we have the beta blockers, specifically the older ones like propranolol or atenolol. Think of these as a speed governor on a car engine. They cap your heart rate so strictly that even when you want to get excited, your heart physically cannot pump hard enough to sustain an erection. Now, here's the most dangerous trap. When men realize this, they often quietly cut their dose or throw the pills in the trash without telling their doctor. Please do not do this. That is a recipe for a stroke. If you just checked your medicine cabinet and realized you are on one of these drugs, don't panic. There are modern, safer alternatives that protect your heart and your erection. And that is exactly what we are going to swap to in the next part. Now, breathe a sigh of relief, because here's the good news. Not all blood pressure medications are enemies of your erection. In fact, some modern options are actually erection-friendly. We are talking about classes like ACE inhibitors, think lisinopril, or ARBs like losartan or valsartan. Unlike the older drugs, these work by helping your blood vessels relax naturally. They improve the health of your endothelium, the inner lining of your arteries, which is the very foundation of a strong, sustainable erection. They don't fight your heart rate, and they don't numb your brain's arousal center. There is even a unique beta blocker called nebivolol that is a game changer. Unlike its older cousins, it actually boosts nitric oxide, the magical chemical spark that opens the floodgates for blood flow. With these medications, your numbers stay safe, but your performance feels natural, not forced. But listen to me carefully. This video is not permission for you to play pharmacist and swap pills on your own. That is dangerous. Instead, use this knowledge to empower yourself. Take this information to your doctor and say, I am concerned about my side effects. Would an ARB or a newer medication be a better fit for me? When you ask better questions, you get better care. However, even the perfect pill is only 50% of the solution. If your daily habits are quietly rotting your blood vessels from the inside out, no medication in the world can save you. And that brings us to the final, most critical piece of the puzzle. Here's the tough love moment that many doctors won't tell you. No pill in the world can fix your erection if your daily habits are actively destroying your blood vessels. High blood pressure and ED are partners in crime, and they share the same accomplices. Smoking? It's basically suffocating your penile blood vessels from the inside out. Excess belly fat? It's an inflammation factory that stiffens your arteries. If you are relying solely on a pill to do the heavy lifting while ignoring these root causes, you are fighting a losing battle. But here's the hope. Your body is incredibly resilient. Simple shifts, like walking 30 minutes a day, dropping just 10 pounds, or cutting out the cigarettes, can restore blood flow faster than you think. I've seen men reclaim their confidence without even changing their prescription, just by changing their morning routine. Remember this golden rule. Medication keeps you alive, but lifestyle determines how well you live. When you combine the right treatment with the right habits, you aren't just protecting your heart. You are reclaiming your manhood and your dignity. So don't let fear rule you. Take ownership of your health today. If you found value in this video, please hit that subscribe button right now so you don't miss my next guide on boosting testosterone naturally. I'm Dr. Emily Carter, and I'll see you in the next video. If you take one thing away from this video, make it this. Losing your spark is not a mandatory price of aging, and you certainly do not have to suffer in silence. The difference between a man who fades away and a man who stays vital after 45 isn't luck. It is action. It comes down to having the knowledge to talk to your doctor and the discipline to protect your body. You do not have to choose between a healthy heart and a happy sex life. You can have both. Now, I want to hear from you. Did this video change how you see your medication? Leave a comment below. I read them personally. And if you are ready to take full control, hit that subscribe button right now. In my next video, I'm going to reveal specific natural boosters that act almost like nature's little blue pill to help your blood pressure and your performance. You do not want to miss that. I'm Dr. Emily Carter. Remember, you don't just deserve to live longer, you deserve to live fully. I'll see you in the next one.